The following portion of Daytime is sponsored by Tampa General Hospital.
It's October, and that means it's National Breast Cancer Awareness Month. Women who take care of everyone else in their lives, are you taking care of your own health? Self-examinations are very important because early detection is key. And joining us today with more on that is Dr. Abigail Beard, Assistant Professor, USF Department of Surgery, Division of Breast Oncology. Dr. Beard, welcome.
Thank you so much for having me. This is such an important topic.
It is, and I know that when we do, at least we hope when we do segments like these, that it will reach women, open their eyes. Let's start with two things that you say that women can do to find the early signs of breast cancer. What are they?
Absolutely. I think the most important thing women can do is, number one, get their annual mammograms and breast exams, whether that's with your primary care doctor, your GYN, or if you already see a breast surgeon, whomever that is. Make sure you're staying up to date on both of those things. And the second thing you can do is really know your own personal risk for breast cancer. Many women have an average risk of breast cancer, but there are a few women who have what is considered a high risk for breast cancer, and they might need more than just that annual mammogram to appropriately screen them for cancer.
How do you know your risk?
So some of the things that are most common that would affect your risk would be a family history of breast cancer, a family history of ovarian cancer, biopsies that you've had in the past, depending on what those results were, things like dense breast tissue, and if you've had certain treatments like radiation to your chest wall in the past. Any of those things can increase your risk.
And regardless, I imagine self-examination applies to every woman.
Absolutely.
So, doctor, what about if, let's hope that, this doesn't happen, but if you get that diagnosis, you have cancer, as a patient, it's got to be overwhelming. What advice do you have for patients?
Absolutely. I think the first most important thing is don't put this off. I know a lot of women get this diagnosis and it can become so overwhelming because the first thing they think of is, as you mentioned, what's going to happen to my family? What's going to happen to everyone else that I care for? And a lot of women will sort of push it off to the side and say, I'll deal with it another day, and delay any care they might need. So I think it's very important, once you do get that diagnosis, be seen right away. Come and see a breast surgeon. Go and see, your primary care doctor, your GYN. Get to that first starting point to help you get to the treatment that you need, and don't delay.
And there are so many good treatment options here in our area. I know that just this month, Tampa General Hospital and the Cancer Center of South Florida opened up a new TGH Cancer Institute in Riverview.
Yes.
Tell me what patients can expect there.
So it's a multidisciplinary cancer facility. We have medical oncologists, surgeons, radiation teams there. We're going to get radiation oncology. We have an operating room there, so you can get all of your care in one-stop shopping.
That is so needed.
Yes.
So as we wrap up the segment, if there's one message that you want women watching this right now, this October, to take away.
Get checked. Get your breast exams. Get your mammograms. If you need extra pictures, if you need follow-up for any reason, do whatever the radiologists are recommending, whatever your primary or GYN is recommending, and don't delay.
There are no excuses, and yet we come up with so many,
Absolutely.
don't we, right?
It's very easy to put it off until tomorrow.
All right, Dr. Abigail Beard, thank you so much for your time.
Yes, thank you.
And if you would like to learn more about TGH Cancer Institute, visit tgh.org/breast cancer. Daytime will be right back.
The preceding portion of Daytime was sponsored by Tampa General Hospital.